USAA knows dynamic duos can save the day, like superheroes and sidekicks or auto and home insurance. With USAA, you can bundle your auto and home and save up to 10%. Learn more and get a quote at USAA.com/bundle. Restrictions apply.
Ah, Smart Water, now in a sleek can.
This feels cool, literally.
Perfect for social gatherings and on the go.
Should I start wearing turtlenecks?
One sip at a time, friend. Smart Water cans, for those with a taste for taste. Get yours today.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode.
All right. Hello, everyone. We have a guest here today, and we were just chatting before we even started recording that it's so full circle. I have Dr. Erika here, and I've been watching her YouTube journey and on Instagram throughout dental school and now working. And she's also been listening to the podcast for a while, so it's so fun to get to connect in this way. And I was really excited to have Dr. Erika on to share her story, and I'm not going to steal any of that thunder. So could you introduce yourself a little bit for us?
Yes, thank you so much, Haley, for having me on. It's truly an honor. So my name is Erika Correa. I am a licensed dentist in New York State, but originally I'm from Los Angeles, California. That's also where I did dental school. I went to USC. After graduating from dental school, I did a GPR in Allentown, Pennsylvania. So moved all the way to the East Coast with my husband and my dog. And after that, I applied to orthodontic residency a couple times. Took me a little bit to get in. I did an orthodontic preceptorship and then worked as a general dentist in Rochester. And now I'll be starting ortho residency in less than a month. So I'm so excited. And for fun, I love to rock climb, and I've recently taken up tennis. So I've been learning how to play tennis. I've been playing every Monday. And yeah, that's a little bit about myself.
That's awesome. Tennis is such a good way to get outside right now, too, with all the nice weather that's starting with the year. I feel like outdoor hobbies are the best.
Yes, I'm excited for that. Currently, I'm doing indoor tennis because in Rochester, it's been snowing until April. So hopefully I can start playing outside soon.
Yes, soon. Okay, good. That'll be so nice. So you gave us a lot of good tidbits about pieces of your story so far. So I'm just going to kind of unpack them little by little. We'll start all the way back in the dental school time. From looking back, what are some of the things that stick out to you as memories, the good, the bad of your time in dental school?
Most of my dental school experience was awesome. I also think I went to a really fun school. I went to USC, so it's in the middle of LA. There's a lot of things to do there. They have a football team, so it's very lively. Like if you go to any events, the marching band is there, and it just feels like a movie. So it was very different than my college experience. At USC, they also have Greek Row, so they have all these like houses, and for dental students, they also have fraternity houses, and they're co-ed. So it was a very fun time. So I had a great experience. Those are some of the memories. I also vlogged my time throughout dental school, and it's nice to look back on those. COVID also happened in dental school, so not the best. It wasn't like the best memories throughout, but majority of my dental school time was fun and educational.
Is there any specific times you remember really struggling, and how did you work through those?
In dental school, I feel like everyone was struggling like with TPXs and with classes. So I never really felt like I was alone struggling in dental school. It felt like we were all kind of struggling together. So having a support system and trauma bonding helps. So I never felt like I was struggling by myself with like dental school classes or dental school TPXs because most of us were going through the same thing. But then when COVID happened, a lot of things changed. And that was kind of a new thing. So instead of like struggling with everyone else, even though we were all going through COVID together, everyone was going through their own thing. And that was really difficult because, well, we weren't in school. We were isolated. It was a tough time in LA. And then I also got really sick throughout this time. I was like trying to figure out, first I had a dental procedure done at the school, and that I was getting an inlay done, and then the school closed because of COVID. So I never got it finished. So I had this hole in my mouth. I was stressed about that. Then I developed this like jaw pain that like lasted for a year, and we couldn't figure out what was going on. Eventually a night guard helped, but I was like having this jaw pain for a really long time. Then I started getting other pains. Like I was holding my phone up to vlog, and just like my hand would hurt from holding my phone up. So it shouldn't hurt. That's like not a normal thing. And then I would just have weird joint pains in other places. And I don't know, something was wrong. I was telling my doctor about it. I don't know. They were dismissing it for a long time, but eventually I got a referral to see a rheumatologist, and I got diagnosed with rheumatoid arthritis, which was really difficult because I was in dental school. I was a third year, and I had all these student loans. So like how was I going to practice as a dentist? I never thought about giving up dentistry. There was no way I was going to do that. But it was a tough time because I was going through this diagnosis, and that was the first time I felt lonely because I didn't have anyone to like go through this with me. So I really had to reach out to like find Facebook groups and find other people that were going through similar situations. So it didn't feel as lonely. But then afterwards, like thanks to modern medicine, I got better and I got through it. We finally found like a medication combo that worked, and now I'm all better. I've been practicing as a general dentist. Like it's not inhibiting me from doing anything. And yeah, that was probably the toughest time. But also before this, like throughout my dental journey, I don't know if you know, I had a Navy scholarship. So originally in dental school, I had this Navy scholarship, and I was going to work for the Navy for 4 years. That was the plan. I was set to do that. I didn't even think about specialty at this point because I was like, after I graduate, I'm going to work for the Navy. There's one ortho program in the Navy, but they don't even take students every year. It's like every other year. So I kind of dismissed it. And then third year of dental school, around COVID time, I got my diagnosis, and I got let go from the Navy because you're not allowed to have this medical condition when you're active duty. So that was a crazy time because first of all, I didn't think you could ever get out of the Navy once you like sign and are active duty. So I just learned life will throw things at you and you just have to adapt. Like that was the craziest thing. But it also opened up an opportunity for me to pursue specialty. So around end of third year, beginning of fourth year, that's when I was deciding, okay, this is another opportunity for me to do something else. So I decided to do ortho because originally starting off, I wanted to do ortho. Like that's originally why I wanted to become a dentist. So that's why I decided to pursue a GPR. Then I decided to do the ortho preceptorship program. So I saw it as an opportunity and I took it, and I'm happy that I'm going to be a resident in less than a month.
Yeah, I'm so excited for you. Congrats about that. There was a lot of good things you covered in that discussion that I want to kind of take apart a little bit and ask you some follow-up questions. So you said, I never really doubted that I was still going to be a dentist and like work in dentistry. How did you maintain that optimism while you were going through, probably in the time, a lot of uncertainty and confusion as you were trying to navigate this new condition?
Well, I was always optimistic, but during that time, I wasn't really necessarily happy or doing well, but I had to figure out what I was going to do next. First I had these student loans. Even though the Navy helped me pay for some of my dental school, I still had to take other loans. So although my debt was lower than another USC student going to dental school that didn't have a Navy scholarship, I still had loans. So I was like, there's no way I'm going to do a career change. What else can I do in dentistry? So I knew I could teach eventually in the future. I don't have to use my hands for that. I can do research in the future. I don't have to use my hands for that. And there's also other specialties that I was looking into. And I told some of my professors, or some of them found out, because like I would go to school and I would have like a Band-Aid because I had to get my blood drawn so many times. Or at one point I had like knee braces because like the amount of prednisone that I was on like made my knees very weak. So eventually people found out. And eventually I made a YouTube video and then took it down because I was like, I don't think I want the world to know about this. But now I'm telling everyone again because I think I'm okay with it now. But so I looked into other specialties and professors were telling me to look into oral radiology. Everyone was saying, go into oral radiology. You just look at radiographs and you don't have to use your hands at all. So I looked into it, but honestly, I hated it. Like I went into dentistry to work with people and to interact with people, not to sit behind a computer. But I still looked into it. I did this externship at UCLA and all the residents were behind a computer in a dark room. And I hated it because I was like, I need the sun. I need a window. Like, I don't know how I'm going to do this, but I wasn't doing well. So I still, like, I wasn't doing well physically. Like my hands were always like in pain. So I was like, I need to do like something that's going to make me money because I still have these loans to pay. So I applied to oral radiology and I remember writing my personal statement. I was crying like every single time writing it because I didn't know what to write. Like it felt like I was lying, which I was. I like didn't like it. I ended up applying. I got 2 interviews. I didn't get in. I was really sad about that because I like put a lot of effort. And then I also didn't know what I was going to do if I didn't get in. I had the option of working as a general dentist, but I didn't know like if my hands would be stable at that point. That was like the time where I was still trying to figure out like a medicine combo that would make me better. So I didn't get in. Then I went to this oral radiology conference because I was going to try again the next year. And then during the oral radiology conference, it was virtual because of COVID. I hated that also. And I told my husband and I was like, I hate this. Like, I don't understand why I'm doing this. Like, I'm doing this because everyone is telling me to do it, but there's other things I can do. Like, I can do ortho. Like, I've been wanting to do ortho. Like, I have to use my hands a little bit, but there's ways I cannot use my hands in ortho. And I'm going to get better. Like, it's going to be fine. Like, I hate oral radiology. This is a sign. Like, I can't do this. So he said, okay. And we both agreed that I wasn't going to do oral radiology, which I'm glad because I would have hated my life. So right after that, I decided I was going to pursue ortho. And since I decided this so late in dental school, this is like the end of 3rd year, beginning of 4th year, I knew my application wasn't ready for ortho because it's a really hard specialty to get into. So I said I was going to pursue a GPR. I heard that recommendation from other orthodontists. So I found a GPR. I applied the same cycle as I did for the oral radiology and used the same personal statement. So if you apply to a residency program and don't get in, you could apply to GPR the same cycle. And somehow I matched into a GPR. And I got a lot of valuable experience there because there's an orthodontist there. And so I got to learn simple ortho. And it strengthened my application. And where was I going from there? Honestly, what was your question again? I started going off topic, I think.
Fine. You've been just going more in depth in the journey, and that's what I was going to ask you about.
Okay.
So at the point of your GPR now, you were mentioning some of the positive experiences you got from it. And I know you've been working after the GPR as a dentist this past year before now you're going to switch over to be ortho resident.
Yes.
But what kind of skills, in addition to working along that orthodontist, did you gain during the GPR compared to dental school? And did you feel like that really helped you with this first real world job?
Yes, I definitely did. So first I learned orthodontics. I didn't learn that in dental school basically at all. We didn't treat ortho patients in the clinic. So I got to do braces in residency, and I got to do a little bit of Invisalign. But then I also got to practice doing fillings, crowns, endo, extractions. I didn't place any implants, but I learned more about them and did a perio surgery, did a couple perio surgeries. So GPR definitely gives you more exposure. And it was an FQHC setting. So we got to see a lot of patients with a lot of different medical conditions. It was honestly very overwhelming and not the best experience at the time. But looking back, like now that I've been working as a general dentist, it made me a better general dentist because I had that 1 year of stress and I learned a lot in 1 year. And it gave me a lot of confidence to work as a general dentist. So yeah, there's a lot of things you can learn from the GPR. It also gives you more opportunities like research. I also did research in pediatrics in my GPR. I learned a lot about pediatrics and got to see a lot of pediatric patients because we also had a pediatric dentist that worked with us. So it gives you more exposure. And then if you're applying to a specialty program, you can get letters of recommendations from those faculty members. And that's helpful as well.
Gotcha. And last thing from what you've said so far, I know you mentioned a little bit that you went in to dental school assuming you were going to do the Navy scholarship and work as a general dentist for a bit. So with that process, what led you to select the Navy and apply for that program? And the portion of your experience that was with the Navy, how was it?
Yeah. So when I got into dental school, I knew that I was going to be expensive. And I actually got into other schools that were less expensive. And I chose USC, the most expensive program out of the ones I got into. I just thought it'd be a better fit for me. I'm from Los Angeles. That's eventually where I want to work, in Southern California. So I felt like it was a right school for me. And my husband's family is also from San Diego. So it was just close to family, close to friends. And it felt like a good fit. But if I was going to pay for this super expensive school, I wanted to see if I can get some financial help. Excuse me. So I looked into the Army, like HPSP, the Navy HPSP. I didn't look into the other scholarships. I think it's just because I didn't know about them. So I was just exposed to the military ones. My husband's uncle was in the Army with the HPSP scholarship. So he said really good things about it. I know someone else who did the Army. They had really good things to say about it. So I just heard a lot of pros about it. So I said, okay, I'm just going to apply. Like, how bad can it be? If they send me to the middle of nowhere, it's okay. It'll be an adventure. I just like had an open mind about it. And I was like, it can't be that bad. And my husband was okay with it. So we just did it. I didn't get the HPSP scholarship. I got a different one called the HSCP. So if you're wondering how to apply for this, you don't. I originally applied for HPSP. And since I didn't get it, then they gave me this other option. So they just like gave it to me as another option. So if you're interested in these scholarships, you just apply for HPSP. So when I was in dental school, technically I was active duty. So I had to take like the physical readiness test. And I just had to report to like the office. I just had to like send them my grades. I just had to be above like a 2.5. Like it was a very low thing. Maybe it was a 3.0. I'm actually not sure. But there wasn't much military things that I did while I was in dental school. All of the military things were supposed to be done once I graduate. But since I was technically active duty with this title, I had some benefits such as the VA loan, which was really nice. So I took advantage of that. I purchased a condo in dental school. Honestly, it wasn't the best financial decision. We ended up selling it, but it gives you options. And there's a lot of options that you get from the military. So if you're interested, I would definitely apply. I don't see the harm in doing so.
And I don't know if I know this about you, but before dental school, did you go right from undergrad to dental school? Did you have a gap year period? What was your journey like even getting into USC in the first place?
Yeah, before dental school, I did have a gap year. Not really by choice. I just didn't know how it worked. So when I was in undergrad, I went to UCSC, UC Santa Cruz. I also took a 5th year. So that was mostly to get my grades up. And my boyfriend at the time, now husband, was staying an extra year. So I was kind of prioritizing my relationship. And then I applied to dental school during that 5th year. And then basically it was a forced gap year. I moved to San Diego, worked a couple jobs to pay off my undergrad student loans, and then went to dental school. But if I was in undergrad, when I was in undergrad, I didn't realize that you had to apply your 3rd year to go to dental school right after. I think if I did, I would have done that. I just didn't know that. I was like, oh, I guess I have to take a gap year. So that's just how it worked out.
Yeah, and I mean, it seems like everything has, looking back, you can see everything kind of fell into place just fine.
Yeah, everything falls into place. And honestly, sometimes I forget I took a 5th year and that I did a gap year. Like no one, well, unless you're on a podcast, no one is really going to ask you, like, how long did it take you to get into dental school or how long it took you to get into ortho residency. Mm-hmm. It doesn't really matter, like, afterwards once you're practicing, as long as you get to your end goal.
Absolutely. So I want to know a little bit about your time working this past year. And you mentioned also the ortho preceptorship. So how was like your weekly schedule? Were you doing those at the same time? How did all that work?
Okay, so after the GPR, I took a year long. I only did the ortho preceptorship for a year, so I wasn't working during this time. Okay. And it was full time. It was with the ortho residents. So I actually did basically a year long of ortho residency. So I'll be redoing that year, but I won't have to take all the same classes that I took because some of the classes I took during my preceptorship year, I got grades for them, so I don't have to retake them. So I'll basically like have an hour break on some of the days, which will be nice. But during the preceptorship year, I also did a master's degree, and some of the ortho residents also did a master's degree. It's optional, but those classes would be from 5 p.m. to 7. So we basically have like classes in the morning, and then we'd go to clinic. So I would go to clinic with the ortho residents, but I wouldn't see my own patients. I would just assist them or observe and help out. And then we'd have more classes, whatever. We'd do the day from 8 to 5. And then 2 days a week, we would have the master's classes from 5 to 7. So that was a lot of work. So the ortho residents who did the master's degree also, that saw their own patients, they worked really hard, and it was a long day. If it was a long day for me. So when I start ortho residency, I'm going to have a little bit of an easier time because I won't have to do the master's and I won't have to do some of the courses that I already took. But I also did research. If you're a preceptor or if you're a resident, it's required for you to do research. So I did one project by myself. I did a systematic review, and then I did a project with someone else who was going to be my co-resident. So, and we published both of them. So that's something that I think really helped me get into ortho. And if I were to give any advice to someone interested in ortho, do research. They really like to see that and try to publish. I did research when I was in undergrad, but I didn't realize that like the goal was to publish at that point. And if I had publications under my belt at that point, that would have really helped.
So how did you get connected with this preceptorship? How did you find out about it? Do you apply to a bunch of all over the country and just hope one lands? How does it work? Yeah, so let's see. How did I find out about it? I think I searched on Google orthodontic internships because why I searched it first was I know that for oral surgery residency, it's really common to do an internship. So I was trying to see if there was ortho internships, and I found some. Like I found a fellowship in Jacksonville, and there was a guy who I went to dental school with who did that fellowship,
And I just saw on their website. I actually didn't know he went there until I saw his picture on the website. And then I reached out and I actually got into that program, to the fellowship program. And they let me know that it's usually guaranteed. Like they didn't say the word guaranteed, but basically everyone that does the fellowship, you see them all going to ortho residency. But I decided to not go there very last minute after putting down a deposit. I decided on the Rochester one. I forget how actually, I know how I found out about the Rochester one. I applied to Rochester and later on they sent me an email. So I didn't look into it until I got an email saying, like, are you interested in the preceptorship program? So they email everyone who applies, it seems like, and that's how people find out about it. So at this point, when I received that email, I already accepted the position in Florida, but I thought I would do the interview for practice. That's actually what I was thinking. I for sure thought I wasn't going to go there. I was like, I'll just practice. It'll be practice for ortho residency next year. I ended up getting in, and that's when I finally started thinking, maybe I should go here. It's closer. At the time I was living in Pennsylvania, so Rochester was closer than Florida. I wasn't able to get a Florida license because I didn't take ADEX. I only took REB, which is the Western Regional Board. And if I got into the program at Eastman, which is the one in Rochester, it's a paid ortho program compared to the one in Florida, which you have to pay a lot of money. So I was weighing the pros and cons. The biggest con to the one in Rochester was that it wasn't guaranteed. But I was so confident. I was like, if they're going to get to know me all year, I'm going to work really hard. There's no way they won't take me. But I took that risk. And of course they didn't take me, I was of course very sad because I put all of my eggs in that basket. But it's okay. I still continued to apply again and continue doing my research, continue doing my master's degree. And then it worked out in the end.
Switch to Verizon Business and get more from your internet without paying more for your internet. Get LTE Business Internet starting at $39 a month when paired with select business mobile plans. That's unlimited data, and with it, unlimited possibilities. Start saving today with Verizon Business, ranked #1 in small business internet customer satisfaction by J.D. Power. Starting price for 25 megabits per second LTE internet plan with smartphone plan savings, plus taxes, fees, and economic adjustment charge. Terms apply. For J.D. Power 2024 award information, visit jdpower.com/awards.
I think you're on mute.
Workday starting to sound the same?
I think you're on mute.
Find something that sounds better for your career on LinkedIn. With LinkedIn Job Collections, you can browse curated collections by relevant industries and benefits, like flex PTO or hybrid workplaces, so you can find the right job for you. Get started at linkedin.com/jobs. Finding where you fit. LinkedIn knows how.
Wow. Like you said, you've really been through a lot of different experiences in this process of what your final goal was of starting ortho residency that's coming up so soon. So I'm super proud of you for always persevering. And it seems like it's probably easier now knowing that you're in, but to look back on it saying, it was hard, but I didn't give up. And I mean, that's really amazing.
Thank you. Yes, it definitely was hard. And applying for the third time was definitely the hardest. That's when for the first time, I was considering maybe not applying, because I was thinking, okay, I didn't get in twice. Maybe the world is trying to tell me that I can just do ortho as a general dentist. Like, maybe this isn't for me. Like, why am I trying to do this one thing so badly when I already have a lot? Like, I already have a license to practice dentistry in the United States. Like, a lot of people want to do that. But luckily I had friends that were rooting for me. They're like, no, you want to do ortho, like you have to do it. Like, so I had a lot of people pushing me to apply again. So that was really helpful because I really needed that little push at the end. And I'm glad they did push me to do it.
Yeah, absolutely. You need sometimes people with a slightly outsider perspective to be like, no, like every year you've improved your application, you're more and more qualified, like this is going to be an even better cycle and everything.
Yes.
Does the process of applying to ortho kind of mirror the dental school application process? Like you're submitting things online, letters of recommendation, personal statement, all your experiences, and then you like go to interviews at the programs in person?
Yes, it's very similar. So for dental school, you do like the ad test application. For specialty programs, you use DiaPass. So you put in all your information there and your personal statement, your CV. I don't know if you put a CV for dental school, but the CV is very important. And then you get interviews, and then you fly out to the interviews and you do well. And then there's a different part that's different from dental school, the match process. So for ortho, they have this ortho match, but you can also apply to non-match schools, which makes it a little complicated because some of the match programs are match specific and they don't want you to apply to non-match schools. I don't know how they know if you've applied to non-match schools, but most of the time people that apply to match schools only apply to match schools, and then I don't know how they do it, but that part gets a little complicated. But basically Eastman, the school I'm going to, is a non-match program, and there's other non-match programs such as Montefiore. Loma Linda was one of them, but they just became match, I believe. Oh, no, actually, they're non-match. They just got onto the DiaPass application. Previously, they weren't even on the DiaPass. So some programs aren't even on that main application, and you have to apply separately, which makes it even more confusing. So the only program I know that's not on the DiaPass application is Montefiore. Everything else should be on there. But once you interview, say you only apply to match schools, or say you applied to some match schools, then you have to rank the schools. So the school that you want to go to, you rank it number 1, then 2, 3, 4, whatever, how many schools you applied, how many schools you interviewed at. And then the schools will also rank you. And then there's match day, which is in November. I think it's like November 21st, around that time. You'll find out if you matched into a program or not. So the way it works for the non-match schools is they'll let you know earlier on in November. So for Eastman, I found out earlier on in November. And since I got in, then you have to send them a withdrawal from match. So they know that you're not going to be part of the match system anymore if you accept the position. And then if you don't get into any non-match schools, then you participate in the match. And then on match day, you find out if you've matched or not. That's how it works.
Wow. Yeah. I would hear a little bit about that when I was a 4th year last year and everyone was going through their specialty applications, because some of the other specialties, their match is like a different couple months than ortho, and like there's 2 little buckets, I think, of like different types of match days.
Yeah, there's phase 1 and phase 2. So ortho's in phase 1. And that's how I was able to apply for the GPR, the same cycle. Like looking back to my like 4th year of dental school, GPR and peds and something else is phase 2. So you can technically apply to multiple specialties the same cycle.
That makes a lot of sense. And however much you're kind of willing to talk about this, but for moving all around the country, you kind of pursuing different opportunities to get you to this end goal, what has that been like from a perspective of you and your husband and kind of navigating everything personally, financially? How has that been?
Yeah. So let's see. So it's nice that my husband has been with me basically throughout my entire journey. Like we met in college. We moved to San Diego for a gap year. We did a year of long distance when I did my 1st year of dental school. He was living in San Diego, so he came to see me every weekend. And then I convinced him to move to LA because I was like, no, why are we doing this long distance? Just find a job here. He was working in research in a genetics lab and didn't like his job. So then when I was going to pursue ortho residency, I was like, I told him also, like, since you don't like your job, like maybe this is a good opportunity to do a different job. Like, we're going to move somewhere else. Like, you can do a career change. So when we moved to Pennsylvania, to the East Coast, he was also going to do a career change. So he did this like software engineering program for a year. So while I was doing residency, he was going back to school. So we've been helping each other. Like, he helps me achieve my dreams. I'm going to help him achieve his dreams. And now he works from home, which is really helpful because then he was able to move with me to Rochester and work from home. So just listening to your partner and helping one another, like, he's like, if I'm ever feeling sad or need like emotional support, I'm happy that he's always there for me. And this is like our future together. Like, although I'm pursuing ortho and like became a dentist, like, he helped me get there. Like, he cooks me dinners, like, he's helped me a lot through this process. So I guess just being there for one another. The moving across the country, I didn't really think about it too much. Like, when I was applying to GPRs, since I applied so late, I didn't have too many options. So I matched into the program on the East Coast. I said, okay, we're moving there. We ended up selling majority of our things and we just drove across the country. But we actually didn't even know how we were going to get there. So like later on, we're like, how are we going to get across the country? So my husband's uncle like let us borrow his truck for the whole year, actually for 2 years. We had this truck that we borrowed. And then just recently we finally like bought our own car, which is so funny because like we've kind of just been getting by this whole time. And now like things are finally coming into fruition and we like finally have a nice car and we finally like have money. He finally has like a job that he loves. I'm finally going into the specialty that I've been wanting to go into. So you just make it work, like one thing at a time. Ask for help.
Definitely. And I mean, like you said, you knew you two were always in each other's corner. And it sounded like even earlier when you were telling me about your decision process between, okay, oral radiology is not for me, I want to do ortho. Like, he's always been so supportive. And it was your decision, but it's a joint decision because it affects both of you. So it seems like you guys have had a good way of going about all of that.
Yes, definitely.
So before we wrap up, tell me a little bit about your year working as a general dentist.
Okay. So this year was interesting. So first off, originally, like, my ideal goal for a general dentist job would be at a private practice. So I was looking, but I wasn't able to find anything in Rochester. And I really wanted to stay in Rochester because ideally I wanted to go to this residency program because it's a really good residency program. And like, I'm already settled here. So that was one of my priorities. It was to stay in Rochester. So I wasn't able to find a private practice. So I ended up working for a corporate office. I don't know if you've heard of Heartland. I didn't really hear of it until I applied. And this was the only Heartland dental office like in the area. So it didn't look like a corporate office. Like, I feel like Heartland is like a secret corporate office because the name of the office was Penfield Dental Care. It doesn't say Heartland on it at all. So it doesn't look corporate. And I was the only general dentist there. So I didn't have like a mentor doc in the office or anything like that. And they paid really well. It was the best option at the time. So I was like, it's only going to be a year. If I did a year of my GPR and completed that, and that GPR was hard, like, I can do this 1 year. Like, if anything, I'm going to learn a bunch of leadership skills. Somehow I'm going to get through it. I actually wasn't even that nervous, but I didn't know what I was getting myself into. So I took this job. I was the only dentist there. It was kind of really nice because the patients, I feel like a lot of them thought that it was my practice, like that I bought it, because like in the beginning, they were congratulating me, like, congrats to you, like, you're working on your own. So I started to think, I think they think I'm like the owner. I wasn't going to tell them I'm not the owner. I'm still doing a great job and like providing the best care. But I've heard that when people work at other offices, sometimes they want to see the senior doctor or a different doctor. So I didn't have that experience. I was the only doctor there. they didn't want to see me. They had to go somewhere else. So those were some pros. And then I learned a lot about leadership. So I had to like run an office with like no experience. So I threw myself in the deep end. I learned a lot about communication. Like I had to communicate with my assistant. I had to communicate with the patients and the front desk and the office manager. And I was basically in charge there, or like they looked up to me as their leader. So when you're in that position, sometimes you have to fake it till you make it, because like you already put yourself into that position. And that's exactly what I did. But the nice thing about Heartland was they sent me on a bunch of CE courses at the beginning. So I went to like an endo course, an oral surgery course, like a bunch of leadership courses. So I learned a lot, which was nice because I did a year without working as a general dentist. So a year without practicing my hand skills and anything like that. So I thought it was a good first job. If I was going into general dentistry and the goal wasn't to specialize, I probably would look for a private practice and I would prioritize mentorship, because that's one thing I didn't really get. Like if I didn't get into ortho and was going to do general dentistry, I didn't learn much about general dentistry and like how to become a better general dentist. Like I learned a lot in that year, but afterwards, I don't think there's much growth, at least in the practice that I was at. Yeah, that's a little bit about how it was.
I mean, yeah, I feel like people say that all the time with corporate. Like there's definitely benefits. And if like you need to be in a specific location or it's a short-term thing, you know you're going to have like just this is how they pay everyone. Everything's just kind of exactly how it is, very cut and dry. And you get that included like specific CE. So there's a lot of, I guess, kind of like stability that comes with the corporate compared to private is a little more like, yeah, you might have a mentor, but like you can only take in the patients that like you're bringing in. It's a little more kind of got to work your way up to the income, I guess, of all of it sometimes with private practice. So there's pros and cons to them. And I think it made a lot of sense for your situation. And I'm glad you could draw away some really quality like leadership skills and everything, because that's going to carry you whatever you decide to do after ortho. But now you're just excited to start ortho. That's the first step, right?
Yeah.
That's awesome. So before we wrap up, do you have any closing thoughts or advice you want to leave with the people listening today?
Just keep trying. Like I said earlier, no one's going to ask you like how long it took you to get into ortho residency or how long it took you to get into dental school once you're a dentist. So, or once you're an orthodontist. So just keep trying. I think like persistence is really important, and try your best. In dental school, I feel like I could have tried a little bit harder, and I feel like not many people say this. But when I was in dental school, I wasn't thinking about specialty. I really didn't think I was going to specialize because I knew I was going to be in the Navy. I tried my best, but I know the people who wanted to go into specialty, they tried just a little bit more. So if you're even considering specializing, try a little bit more, because what if you decide you want to specialize? Like it may take you less cycles of applying. It'll save you time. So try your best. Try to get into research. I think research is really important. Try to find mentors, because who you know is almost always more important than what you know, because you need people that are going to put in a good word for you when you need it. So find good mentors, do research, and try your best, and don't give up.
I love that. I know this episode is going to be really motivating and inspiring for people, whether they're doing ortho someday or not. I think there's a lot of parallels people can draw for whatever their story is. So thank you so much for your time today.
Thank you so much, Haley. It was an awesome time speaking to you.